I'm Dr. Kevin Zawacki. I'm an interventional cardiologist with IU Health. I started practicing medicine in 1997. I became a physician because at a very young age I was extremely interested in the sciences. I came from a small town in northern Michigan with my family having no experience in medicine at all. My grandmother, who was a very profound influence in my life as I grew up, eventually became ill with heart disease when I was a junior in college and unfortunately passed away. That was the event that sort of led me toward a career in medicine and specifically a career in cardiovascular disease. When I meet a patient for the first time, they can expect that I'll have reviewed their medical record. I'll have reviewed all of their applicable studies and looked at the studies in person that are relevant to my practice with regard to cardiovascular and interventional cardiovascular disease. I'll ask them questions that are open-ended because I'd rather hear their story in their own words rather than their story translated into my words. I think that we work better together as a team. I view myself as a consultant, not a dictator. At the end of the evaluation, I will discuss with them all of my thoughts regarding their diagnosis and management, and we'll move forward together as a team. What I love about the practice of interventional cardiology is that it's kind of the natural bridge between the medical world and the surgical world. I do a lot of invasive procedures treating coronary artery disease, valvular heart disease, and other forms of structural heart disease. It's incredibly rewarding to be able to take a patient who is often in extremis, treat them, and within 40 minutes or an hour, have them laughing with me and asking when they can go home. There's no other specialty, in my opinion, that offers that. It's the passion of my life to manage these patients, do and understand these procedures, and it's been with me the entire scope of my career. I spend a lot of time at home with my wife, Teresa. We do a lot of gardening type work in our yard. We take care of our large number of pets, whom we care for greatly. I spend a lot of time listening to classic rock music, and I read a lot of military history. I spent about 25 years in the Navy. That's how I got my medical education. And understanding the service member and what we've been through both individually and as a country is hugely important to me. So that's kind of how I spend most of my time when I'm not at work.